the Senate. The senator from Kansas.
Mr. President, included in the new taxes in this health reform is a tax hike of $20 billion on medical devices. Now, the nonpartisan Congressional Budget Office and Joint Committee on Taxation both confirmed these excise taxes will not be borne by the medical device industry, but instead are passed on to patients in the form of higher prices and higher insurance premiums. Who are these folks that'll bear the burden of this new tax? People with disabilities, diabetics, amputees, people with cancer, just to name some of the people, and more, who will see their costs go up because of this tax. We don't want to do this. Why should we want to do this on those that are most vulnerable? This amendment would prevent this new tax from raising the already high costs for this group, and a tax that will stifle the Medicaid device technology and innovation of this country. I urge my colleagues to support this amendment. It is offset by an amendment similar to that offered by Senator Schumer.
Time has expired.
Finance Committee, so it must be bipartisan.
The senator from Montana.
Mr. President,
Senate is not in order.
President, how has Kansas and Kansas State done lately? Mr. President.
Senator from Montana.
Mr. President, this is a very simple amendment. This bill, health care bill, is premised on the assumption that all groups should participate in finding the correct health care solution for our health care system. That includes hospitals, pharmaceuticals, and also includes device manufacturers. So this amendment would exclude one section, device manufacturers. And how is it paid for? It's paid for by reducing the number of people who would otherwise get tax credits to help pay for their health insurance. I don't think that's what we want to do. Eliminate one group and then put the burden on folks who otherwise would have to pay more for their health insurance. That is the group whose income is below 8%, where health insurance be 8% less than their income. So I, frankly, move to table this amendment, and I ask for the ayes and nays.
Is there a sufficient second? There appears to be. The clerk will call the roll.